We're going to get right to the latest. Once again, we have seen another surge in U.S. cases. Now there are more than 44,000 with 550 deaths, with yesterday marking the deadliest day yet here in the United States. Also breaking overnight, a deal appears to be close on that nearly $2 trillion economic rescue bill as President Trump announces he is eager to reopen the country for business. Meantime, after surveying its athletes, the U.S. Olympic Committee has joined the ranks of nations now calling on the Tokyo Games to be postponed. And officials in China have announced the lockdown in Wuhan, where the outbreak began, will end on April the 8th. That's nearly 2.5 months after it started. In a moment, we will talk to the Trump administration's coronavirus response coordinator. But first, let's go to NBC's Tom Costello, who starts off our coverage. Hey, Tom, good morning.
Good morning, Hoda. So we have an awful lot of moving pieces. Let's begin with the airports and airlines. Devastated, as you know. This airport is empty. The parking lot is empty. The Wall Street Journal reports the airlines are now drawing up contingency plans to shut down domestic air travel. Our sources say it's premature at this point. However, they acknowledge they have planes flying with just single-digit numbers of passengers. It has been devastating for them. Florida requires anybody flying in from New York to be quarantined for 14 days. In the meantime, the president says he wants to get the economy and the entire country moving again. But experts say if we remove or scale back the social distancing requirements, the results could be disastrous.
Our country wasn't built to be shut down.
With the U.S. economy grinding nearly to a halt, President Trump appearing to send mixed signals, suggesting the response to the crisis may be overblown and warning the lasting financial impacts could be severe.
America will again and soon be open for business, very soon, a lot sooner than 3 or 4 months that somebody was suggesting.
While also acknowledging the coronavirus situation will get worse.
Certainly this is going to be bad, and we're trying to make it so that it's much, much less bad.
The president downplaying what experts have said is the continued need to restrict social movement in order to slow the spread of the virus and the increase in the number of cases and deaths in the U.S.
If it were up to the doctors, they may say, let's keep it shut down. Let's shut down the entire world.
Overnight backlash after the lieutenant governor of Texas suggested some seniors are willing to die to get the economy moving again.
Those of us who are 70 plus, we'll take care of ourselves, but don't sacrifice the country.
In the nation's current epicenter of New York, which has seen a surge in new cases, social distancing is still the order.
This is the group that needs to absolutely social distance and self-isolate at this time.
Dr. Deborah Birx, a member of the White House Coronavirus Task Force, also acknowledging her own recent decision to stay home when she was feeling sick.
Saturday, I had a little low-grade fever.
Uh-oh.
So I got a test late Saturday night, and I'm negative. I stayed home another day
As the White House is focused on flattening the coronavirus curve on Capitol Hill, an intense back and forth over relief funding.
They ought to be embarrassed. This is not a juicy political opportunity. This is a national emergency.
We Democrats are trying to get things done, not making partisan speech after partisan speech.
Meanwhile, with healthcare providers facing critical supply shortages, the Justice Department says it will now prosecute those who hoard essential protective products in an effort to price gouge. One other development this morning, an Arizona man has died after he took chloroquine phosphate because he believed that it would protect him from the coronavirus. You may recall the president has been talking about chloroquine in a tablet form, which is a malaria drug, which he believes could in fact help people who are struggling with the coronavirus. We talked to this man's wife, who is now also in the ICU, about how and why he took this particular chloroquine phosphate.
Did you see the president's press conference? Where did you hear about?
Yeah, we saw his press conference. It was on a lot, actually.
And then what? Did you seek out chloroquine?
I had it in the house because I used to have koi fish.
So this particular form of it that he took was used to kill parasites in fish, apparently. As you know, the FDA is looking at whether chloroquine could be used. It's a malaria drug, could be used to help people with coronavirus, but not in a raw form, certainly not in the form that you would use to kill fish parasites. Savannah, back to you.
Oh, that's an awful story, Tom. Thank you very much. By this time tomorrow, more than 40% of the country will be under a stay-at-home order. Health officials say it's critical to prevent further spread of this virus. But are people heeding that warning? NBC national correspondent Miguel Almaguer is in Los Angeles with more on that story. Miguel, good morning to you.
Savannah, good morning. Here in California, the governor says people need to better self-regulate their social distancing, but many people are simply not in compliance. Now, many states are actually threatening jail time.
While many of the nation's most congested highways and busy streets have gone ghostly empty, beaches, basketball courts, canceled festivals, and farmers markets drew massive crowds, despite the national call for social distancing. After scenes like these in California, overnight LA County park trails were closed. Parking lots at beaches were shuttered, and many recreational playgrounds were locked up.
The young and healthy have a unique obligation to the seniors to keep them safe. And you can't do that at a pickup basketball game.
With no federal mandate on public gatherings, individual states, counties, and cities are handling restrictions differently, leaving some simply ignoring orders to stay away from crowds.
I just feel like there's been so many viruses and stuff that's like I've seen throughout my lifetime. It's kind of just another one.
As states try to simplify their message, well over a dozen, with more likely to join today, have told nearly half the nation's population to stay at home.
Don't leave your home unless someone's life depends on your leaving.
There are exceptions. Going to the grocery store or solitary exercise is permitted. But in Oregon, where thousands flooded beaches, failure to comply could now result in up to 30 days in jail, a fine of up to $1,250, or both. Across the nation in Florida, the governor is refusing to institute a stay-at-home order, but he is discouraging visitors coming from New York. A new mandate requires those arriving on a flight from New York's tri-state area to self-quarantine for 2 weeks. This morning, a nation connected by a growing call to push us all apart.
Social distancing is incredibly important, especially in busy metro areas like the New York area, where the attack rate is said to be 5 times higher than other areas. While there are no federal mandates regarding social distancing, the federal government has said all Americans need to keep at least 6 feet away from each other, no matter where they live. Savannah?
All right, Miguel Almaguer, thank you so much. And we're joined now by Dr. Deborah Birx, the White House Coronavirus Response Coordinator. Dr. Birx, good morning. It's good to see you. Thanks for being here.
Good morning.
Let's talk about what the president said in his press conference yesterday. You were right there. He talked at length about easing social distancing sooner rather than later, said weeks, not months. Is that advisable?
I think we're looking very closely around the world about specifically Italy right now because they're reaching their 2 weeks of clear social distancing and looking at the impact. We are seeing the number of deaths starting to decline. So we're in a space where people have made generalized recommendations for many decades on how to confront an epidemic. Now we're confronting a real epidemic, and we have to be willing to adjust our plans as we see impact.
Do you think it will be weeks, not months, that this social distancing will be required?
I think the question is really, can we be laser focused rather than generic across the country? In other words, can we use our data in a laser focused, granular way to really look at what's happening on the ground and adjust our public health messages based on what is actually needed by the number of cases and the work that we're doing with the communities?
Can you do that? Is it really feasible to isolate those hot spots and prevent the virus from spreading?
I think that is the question that we're all looking at very carefully now. So we're coming from models. Again, I said we've never really confronted this type of epidemic before that hit during a flu season, to really be able to dissect out what was flu, what was COVID, and really understand who was at risk and how they were at risk. And so we're getting critical information now from all of the front lines. We know in specific metro areas and all the areas that have rising number of cases should be following all the president's guidelines. Those were very clear. They were sent out over a week ago. And this is my plea to every American. Please continue to follow the presidential guidelines.
Are you confident that the president will listen to you, to Dr. Fauci, to Dr. Adams, the Surgeon General, if you were to say, look, we know it is a hard pill to swallow, so to speak, for the economy, but to save lives, we have to continue this lockdown? Are you confident he would listen to that advice and take that advice?
I am confident that the president has listened to and seen all of our data as it evolves. I think you can see that the president over these 3 weeks has been very focused on what the American people need, both economically and public health wise. And I think it's incumbent on every public health official to be looking at their data in a very granular way to understand who's at risk of hospitalization, who's at risk of mortality, how do we stop the spread, and really move to a 21st century supercomputing approach rather than a more generic slide rule-based approach.
But in the meantime, I mean, time is not on our side. As we are looking at that data, and certainly such an approach would be preferable, you have to continue to have this social distancing, right? I mean, I'd seen one estimate that says if you don't flatten the curve, we could have 2 million deaths.
This is absolutely correct, and that's why the president and the vice president yesterday kept coming back to what we need to be doing right now. What the president is doing is looking for the future and looking what we can do in the future, not looking and change what we're doing now. Please, he's made it clear, and the vice president, continue to follow the guidelines of social distancing and all of the other things about knowing where your hands are and washing your hands.
Let's talk about this phrase that's been said by the president and lots of people, that we can't have the cure be worse than the disease, meaning you can't have this social distancing and the economic lockdown and the shutdown of America be worse than what transpires when you have the virus. There's a doctor writing in the New York Times over the weekend, Dr. David Katz. He said the public health consequences of this near total meltdown of normal life will be long-lasting and calamitous, possibly graver than the direct toll of the virus itself. The stock market will bounce back, but in many businesses never will. The unemployment, impoverishment, and despair likely to result will be public health scourges of the first order. He is arguing that what doctors such as yourselves are advising right now is worse than the spread of the virus. Do you agree?
I think we're factoring all of those elements in, and I think there's a fine line and a place to go that balances the needs of the American people both today and tomorrow with the reality of the epidemic. And that's going to require really precision, granular data, and that's what we're collecting now in order to really see that and understand that. To everyone in New York, you are in a very difficult place, and if any city should be adhering to the presidential guidelines, your governor and mayor, it's New York and the New York metro area right now.
Right now, New York they're getting positive tests back at a rate 3 times than what we're seeing in other parts of the country, correct?
And the reason this is we had a backlog. And so it's very difficult at this moment to interpret the test positive data because we're running tests. We got the high throughput up just now 8 days ago. We're running those high throughputs. There was a backlog. And so many of the positives that you're seeing in this surge are people whose tests came in 3 or 4 days ago. We're hoping to be able to move through that backlog soon.
Okay, Dr. Birx, before I let you go, the Surgeon General was on this show yesterday, and he was very blunt. He said he wanted to tell Americans it's going to get bad this week. Do you agree? And in what way? What should people expect?
So the cases you're seeing right now hospitalized, and this is a very important point for the American public, what we're seeing in the hospitals now are people who most likely got exposed and sick more than 2 weeks ago. So you're seeing what was occurring 2 and 3 weeks ago. So the things we have put in place over the last 8 days and what the mayor and governor has done over the last 7 days, you won't see the impact of that for at least another 7 or 14 days. And that's why you can't always just look at the hospital rates to determine whether you're having an impact epidemiologically.
All right, Dr. Deborah Birx, it's a busy morning. I'm glad you're feeling better, by the way. Thank you very much for being with us.
Thank you.
All right, Hoda, over to you.
All right, Savannah, thank you. Spain has been hit especially hard by the coronavirus pandemic, and residents there are under these very strict stay-at-home orders. So a group of police officers doing its part to lift the spirits of everyone who is stuck inside their homes. Take a look at what happened when a few officers rolled up into a neighborhood in Mallorca. Come on, how about that impromptu performance? It turned into a sing-along. The neighbors joined in from their windows and their balconies. The officers promised the street show was not a one-night-only gig. They say they're going to be singing that song until life returns to normal. So imagine seeing those police cars go up with lights and sirens and then breaking out into music. All right. Speaking of uplifting, let's go to Mr. Roker, check of the weather. Hey, Al.
Hey, Hoda, that's kind of like a SWAT team singing with a tenor or something like that. I like it. Very nice. All right. Well, we got some severe weather to talk about. I know, bad dad joke, but I've been cooped up. Anyways, talking about some severe weather, midsection of the country, we've got severe thunderstorm watches now for parts of northern Oklahoma. This is all pushing to the east, and we've also got an area for 6 states. We're looking at severe weather for 8 million people from Missouri on into Arkansas, parts of Tennessee, into Georgia, where we could see some tornadoes, heavy rain from Missouri to Virginia, gusty storms into the Tennessee River Valley this evening. Tomorrow, that heaviest rain with this current storm track should stay south of New York with some light, wet snow for the Appalachians. But if that storm moves a little further to the north, we could be looking at heavier rain and some more snow in the northeast. Locally, though, right now in the mid-Tennessee River Valley and the Mississippi River Valley, could be upwards of 4 inches of rain. Rest of the country, nicer day in the northeast, severe storms in the midsection. Look for some record highs through the Gulf and Sierra snow moving into the west.